Okay.
So, hello friends, I'm showing you now the other big addition for the beamer. Here you have the beamer. And I have not talked about this now, but I wanted to create the beamer really to give us as many functions of the LaesEr as possible in this very small form that you can take anywhere. And now I'll show you here the heart rate variability system, and here you have two channels. So on one channel you can have the heartbeat. You see here, this is the channel 2. It blinks with my heartbeat. You see, if I take here the sensor off, of course this will stop. Yes. And then, you know, actually this is an ear sensor, but I feel it's a little bit more tricky to put it in the ear. You have to move it quite some time back and forth. Maybe it's my ears especially flashy or something, but as strange and funny as it is, if you put it in your nose, then you will see that actually, well, no, now it's not so easy. Let's see. See, now I have it in my ear, and well, before. See, now you see my heartbeat in my ear, in my nose. And you see it here on the screen. That's the oscilloscope setting, and that's the beats per minute. So you can have the heartbeat reading everywhere, but another way, which is very simple, is here to put it on your finger. See? That also works very well. Now on channel 1, I'm having here, you see a frequency, much higher frequency, something that I have recorded that I want to treat. So you have the possibility, and that's a very unique thing. You can treat with the heartbeat and with another frequency that you record from the core, or that you can download from the quantum doctor. And now you have exactly this DLE, this polarity between two things. One is your own frequency, that's what I consider the carrier. And then the other thing is the message that you want to convey. So if you have a frequency, for example, that you know is good for this or that problem, you can download it from the quantum doctor, or you can, and that's, I think it's my preferred way to do it, you can have the core run a test and find the resonant frequency, and then download it right here to the beamer by plugging in the HDMI to the headphone output, and then you can just store it here just like on any flash drive. So now what you can do with the beamer is just, it's a whole electrocardiogram system. But now when you look here at this, the oscilloscope of the heartbeat, it's not really the standard one that you see in many textbooks. And I've seen that it's different for every person, and we would not be surprised about this, that the heartbeat pattern looks different for different people. And that there's not always the standard one that you see in all textbooks, because they only copy from each other, they don't make any tests. And this is very interesting, that it is very similar for me all the time I'm doing it, but of course there's a variation, but it's very different from person to person. And you know, this shows us that our science is not really about finding out client or person specific things, but it wants to generalize. So there's one heartbeat, and that's the way it should be for everyone. But with this you can see it's not like this. But there's many techniques, of course, that you can make in an electrocardiogram show always the same pattern if you put some filters to take some higher and lower harmonics out of the oscilloscope or out of the electrocardiogram. So you can make it always look almost the same. But here you will see people are different, not with their face only, with their eye color, but of course with the most central thing about their physiology, which is the pattern of their heartbeat. And now with the beamer you have the possibility to show it. You can see things like beats per minute, and you can see the mean between beats, which here is, for example, 665 milliseconds, and then it's the standard deviation 2.24, and you have all the data. But in the next time I will show you how you then can do a very sophisticated heart rate variability evaluation with the other software that you can also download. But for me the main thing is that with this system you have a way you can record now the heartbeat and then run the heartbeat as the carrier frequency for any other frequency that you want to apply, and not only 10 minutes, half an hour, you can then apply it 24/7, not only as light, also as infrared laser light, as magnetic, and as tense electric stimulation. So much for now. I will show you more possibilities, but this is just another aspect that we sell as a separate module that we call the Heart Pass module. It's something that you can add on later. It needs some software and it needs a special adapter, but you can read about this on our website. Okay, thank you.